Most men wish their penises were longer. Until the release of the P-long study, there was not a scientifically proven natural way to increase the length, girth, and function of a healthy and normal penis. If you've never heard about the amazing results of the P-long study, stay tuned. No longer will men have to attempt questionable therapies to increase the size of their penis and incur unfortunate results. Believe it or not, most men seeking penile elongation treatment have a normal-sized penis that functions properly. Men complaining of a small penis, despite adequate length, typically underestimate the size of their own penis and overestimate the length for other men. We'll get to how the P-long protocol helps improve a man's length, girth, and function, but first let's discuss penile anatomy and how that affects the possibility of penile growth. The penis is composed of 3 cylinders, 2 erectile bodies called corpora cavernosum that are comprised of spongy vascular tissue wrapped in an envelope of durable but stretchy tissue made out of collagen and elastin. Elastin gives this tissue its stretch. The 3rd cylinder is called the corpus spongiosum, and it's made of spongy tissue with the urethra, the tube that transmits urine, traveling through the middle. The corpus spongiosum also incorporates the head of the penis, also known as the glans. The corpus spongiosum gets engorged with blood, but does not get rigid like the erectile bodies. The right and left erectile body attach to the pubic ramus on the underside of the pelvis. This is the anchoring point for the base of the penis. Approximately half of the penis is on the inside and half is on the outside. Now, if anyone ever asks you how long your penis is, take the length on the outside and double it. And if they ever question you about it, then tell them that half is on the outside and half is on the inside. Another important structure is the suspensory ligament, which hangs the mid-penis on the underside of the pubic symphysis, which is the area just above the base of the penis. Now, the average penis size varies by country. The length of an erect penis in the United States is 5.1 inches. 80% of Americans fall between 4.3 inches and 5.9 inches. North Koreans are less fortunate, with an average length of 3.8 inches, and in the Congo, there is an abundance of penile length at an average of 7.1 inches. Penile traction devices have been explored to help with penile elongation. These devices cradle the penis and gently apply tension in an attempt to stretch tissue and increase length. In order to grow length with a traction device, you'll need to keep it on for 6 to 9 hours per day for 6 months. Maybe that's why so many men want to work from home. But that only gives you length, so you get what we call a pencil penis. Instead of stretching, doctors inject fat and fillers into the penis for penile augmentation. These fillers are expensive and only last a year or two, and then you have a lumpy, bumpy penis. Some doctors tried surgery to release the suspensory ligament of the penis. This was a disaster because it changed the angle of an erection so that it points down, and the scar tissue from the surgery eventually makes the penis shorter. Now there's a new surgical implant called the Penile, developed by Dr. Elist, a urologist in Beverly Hills. It's a permanent cosmetic enhancement to the penis that reports to be natural looking and feeling. At first this looked promising, but dozens of implants have been removed over the past few years from unhappy men with infection, pain, or dissatisfaction, and the scar tissue from the removal reduces penile length. The Penile does not improve function or length, just girth, so that men get what we call a pig-in-a-blanket penis. At Brandeis MD, we looked at the serious issues with penile elongation surgeries, injections, and implants, and realized that we had to do better. I developed a penile elongation protocol, which I then submitted to an institutional review board for approval. We did measurements of the erect penile length and girth at baseline and then once a month until the end of treatment at 6 months. It was critically important to obtain these measurements so that we could confirm that penile length was increasing without sacrificing girth. In addition, we used a validated questionnaire to confirm maintenance or improvement of erectile function. Our results were amazing. Men grew almost an inch in length and almost a half an inch in girth, and their penile function improved. There were no side effects, and the stretching protocol was only 35 minutes in the morning and 35 minutes in the evening. The PRP injection or P-shot were only once a month for 6 months, and all men took 2 tablets of the Affirm nitric oxide booster twice a day. All of our patients were happy, and many of them have continued to take Affirm, come in for P-shots monthly, and stretch their penis with continued gains. If you are interested in finding a P-long provider, please visit plongprovider.com and find a qualified doctor in your area.